CDC has a warning about a potentially deadly disease that most people have never heard of, and it's already here in this country. Chagas disease. It is spread by this ugly thing, the so-called kissing bug, but it can lie silent for years before it can cause heart failure or stroke. Joining us is one of the authors of the CDC report this morning, Texas A&M entomologist Dr. Gabriel Hamer. Dr. Hamer, thanks so much for joining us this morning. We appreciate it. Let's start with the basics. I've never heard of this disease. What is it, and why have most of Americans never heard of it before? Chagas disease.
Yeah, no, thanks for having me. So this is considered a neglected tropical disease. So that's partly why we don't hear a lot about it in the United States. But we just published this recent article recognizing that, the kissing bug vectors, the parasite that causes this disease, and infected wildlife, they all occur here in the United States. And they actually have for a long time. And so we're just kind of raising awareness and kind of providing some evidence that would suggest that really we need to refer to this as an endemic disease in the United States.
Dr. Hamer, how is Chagas disease passed on from these bugs to the human vectors?
Yeah, so this is an unusual form of vector-borne disease transmission. When we think about mosquitoes or ticks, that is delivered. The pathogen is delivered through the bite, whereas with these kissing bugs, the parasite remains in the digestive tract, and so it's actually the kissing bug that ends up contaminating the human host.
And what are the symptoms that people should look for if they or someone they know has Chagas disease?
Yeah, so this parasite causes both an acute and a chronic stage. The acute is obviously shortly after infection, and often it's fever-like symptoms. But what gets really dangerous would be the more latent or prolonged type of chronic disease that it can occur, which often is cardiac or digestive. There's different types of symptoms there.
Is what's happening confined to farms, outdoors, or suburbs and cities also at risk?
So it does tend to be a little bit more of a rural type scenario because that's where you find the more sylvatic habitat where these kissing bugs are living with wildlife. Then they occasionally will enter the human households and settings. But there are cities in the southern U.S. that definitely have these right within the city.
Is there a blood test that people can take if they think they might have Chagas disease?
Yeah, so there's definitely diagnostics available that are often done through health departments or the CDC, and they're either looking for antibodies indicating somebody has been exposed, or in some cases they can actually look for the parasite.
Can you put this in perspective for us in terms of case count or how widespread this is at this point in this country? And are there certain regions in the country that are more at risk?
Yeah, so it's good to recognize that in the United States, we have hundreds of human cases of Chagas disease. Of course, most of those are imported because they were exposed elsewhere. Texas is unique because we've had this disease as being reportable since 2013. And so from 2013 to more recently, there's been 50 human cases that did not have a travel history. These are people that live in areas where we know kissing bugs occur, and our health department has confirmed or determined that they have been locally acquired. So autophagous disease is that's called.
And what is the treatment, Dr. Hamer, for Chagas disease? And can people pass it? In other
Yeah,
words, their own immune system help them fight it, or do they need a specific medication?
yeah. So some people and even some dogs can do what's known as self-cure. So some people don't actually ever develop that chronic disease. It's hard to know why some people end up with that. But there are treatments. They're not the best, and they tend to be better early after infection. So during that acute stage of infection, that tends to help improve outcomes. But yeah, there are experimental drugs that the CDC is usually involved in delivering those to patients.
Dr. Hamer, thanks for teaching us about Chagas disease, something I had never heard of before, but now we know what to look out for. Really good information.